Okay, so I'm at ANRO's 2016 conference on the final day, and I'm with Dr. Michael Salter, and he's about to present on changing attitudes of men and boys in the prevention of violence against women and children. So if you could just give me a quick rundown of what you're about to present on.
We did a little bit of work for the New South Wales Government looking at best practice in engaging men and boys in the primary prevention of violence against women. So really, looking to report on some of the findings, but also just starting to sort of pick apart really what is the role of men and boys in primary prevention. And certainly I think for some agencies, in some of the literature, there's a tendency to just assume if we engage men and boys, we've prevented violence against women. We really want to challenge that and just sort of situate, program work with men and boys in a much broader context, and really say, the challenge for the primary prevention of violence against women is much, much bigger than just getting men's bums on seats and going through a workshop with them. That's not going to be enough. That's a component, it's not going to be enough. So, what else needs to be happening? What kind of scaffolding do we need around existing programs in order to enhance their impact and make sure that behaviour change and attitudinal change is sustained?
Okay, so can you give us some examples of what a good program or long term?
We've been looking particularly at in the NRL, the Respectful Relationships program. There's been really interesting. Yes, they're doing that programmatic work with men and boys, but it's embedded in a broader health promotion agenda where they're actually looking at the well-being of the men and boys more broadly. They're looking at alcohol, they're looking at drugs, they're even looking at career planning in sport. And also supporting the men who take an interest in this work to then train up and then drive the program forward, drive the prevention program forward. So it's a really key aspect is that once an organisation or a community is invested in prevention, they are the ones that will implement it. And it just has much, much bigger effect and buy-in than an external agency coming in, briefly contracted to tell people what to do, and then they leave. That's not the kind of effect that we're looking for. So the NRL is doing really interesting work in this area, and we've been looking also at a program run in New South Wales called Strong Aboriginal Men, working in Aboriginal communities, and that's been really interesting around the kind of community mobilisation of Aboriginal men, self-mobilisation to try and solve some of these issues. It's been great.
Okay, and so yesterday we talked a lot about, the topic came up a lot about how community-led interventions, especially in an Aboriginal community, are more effective than top-down approaches. So can you describe that program in particular and how it is community-led?
Yeah, so it's based within an agency in New South Wales Health, but they've got a long-standing 30-year history and a memorandum of understanding with Aboriginal communities. They've got quite a strong advisory group, real commitment to the work, and they've been working with Aboriginal women for a long time. The women basically said to them, can you please work with our men? We're not the ones actually doing this. And so this agency actually went through the process of, recruiting and mentoring. They already had, an Aboriginal workforce, but recruiting and mentoring Aboriginal male educators, which was the first time that had men working in the service, let alone an Aboriginal man. So looking to support him and mentor him and facilitate his professional development. And then because of the community connections of their educators, community representatives come forward and they nominate and they say, look, we're looking for help around resolving these issues. So what Strong Aboriginal Men does is it just goes, they work with the communities, they just create a space to start to have this conversation. They provide some structured workshops to sort of feed into the community conversation, but it's quite a broad conversation that takes place over often 4 to 6 months. And then at the end, they work with Strong Aboriginal Men, the community works with Strong Aboriginal Men to formulate an action plan and then to implement it. But one of the things that we really liked about this was that those men who complete the workshops with Strong Aboriginal Men, they are then able to, if they elect, they can then go on to further training and ultimately to matriculate into a university pathway. So that needs more funding, it needs more support, but that possibility that initial primary prevention can then actually develop a new Aboriginal prevention workforce. For us, that was just really outstanding.
Great. And so with this research, at what point is that? Where are you in terms of progress?
We've completed it. We handed it to, we gave it to New South Wales Government last year. And certainly the NRL program that we put forward did get funding. there's ongoing work, and I think the evaluation that we did really helped facilitate more connections between strong Aboriginal men and the government, and I think there's ongoing dialogue there. It was a pity that they didn't get the funding that we wanted them to get.
Yeah.
Look, and the other recommendation that we made to government is to stop this short-term contract funding. You know, we need a sustainable prevention workforce that can work in this space for years and years and years, and that's not going to happen if they are on 1 or 2 year program funding. And we need more funding for evaluation as well.
Yeah.
We haven't seen any sign that's been taken up by the government, but those were certainly our recommendations.
And is there anything you're working on now that's a result of that work?
Yeah, developing more of the conceptual framework around primary prevention, and starting to look at how we can situate primary prevention on a continuum with some of the broader gender equality work that's being done nationally, and also how does it connect to perpetrator interventions as well, because a lot of the men that are in a primary prevention space have offended actually, and what kind of support can we provide them with that?
Just one last question, how does this all sort of fit in, do you think, the role of men and boys with the gender equality sort of framework?
Yeah, I mean, obviously changing attitudes and practices is really key, but, you know, in my view, I think a more important dimension to it is actually just to facilitate support and understanding amongst men and boys in the community around violence against women, and also to get them on board in relation to the broader gender equality work. You know, we live in a male-dominated society. If men don't understand what's being done in gender equality and violence against women, they are going to resist it. So what we want is we want a bulwark of support so we can keep doing this work. It's not a win-lose situation. Men win in a gender equal society, and that's a really important message.
Great. Thank you so much for your time.
My pleasure.
Hello, Michael. I'm Rodney. Good to meet you.
Finally.